Hello, my friends. This is Dr. Felipe with the second section on gender ideology, second and last section. We will continue with our discussion on gender ideology. So, is gender dysphoria a mental disorder? Just for a quick detour here. Remember that gender is that psychological concept that individuals have of their sexual identity, which may or may not be the same as their biological sex. And dysphoria means unhappiness, anxiety. So if you have gender dysphoria, then you have unhappiness and anxiety because of your gender, because your gender is incongruent, meaning that your sexual identity, your concept of your sexual identity is not congruent or the same as your biological sex. So gender dysphoria. Until recently, the APA, which is the American Psychiatric Association, the psychiatrists in the United States, considered gender dysphoria a gender identity disorder. And actually, that was the actual name that was given to this condition, gender identity disorder. So medical and mental health professionals admit that gender dysphoria causes emotional anguish, but claim the solution is not mental health treatment. Even though it's a diagnosed mental health disorder, the treatment is the sex transition treatment, but a sex change is the treatment that is recommended. But gender dysphoria is a mental disorder, and it should be treated, obviously should be treated by a mental health specialist. However, the recommendation is a transition of the sex from one sex to the other. So, sex change, if you ask me, sex change of a minor should be considered child abuse. So what is the official treatment for gender dysphoria? It's to affirm the child in his sexual identity confusion. So when a person is confused, any person is confused, you should try to relieve the confusion. But no, the treatment that is recommended is to affirm the child in his sexual identity confusion. So you're affirming a state of confusion, and that causes even more anxiety, I would think. And then it's followed by the administration of puberty blockers. Puberty is a normal phase of the growth and development of the child that happens just before adolescence, and it heralds the development of the secondary sex characteristics. So puberty is blocked, and then after that, the child is given cross hormones for life into adulthood. So what are cross hormones? Cross hormones are sex hormones, I should say, of the opposite sex. Estrogen for boys, testosterone for girls, and eventually mutilate normal and healthy organs. So what are the consequences of this terrible treatment, if you ask me? So what are the consequences for boys of gender transition? Estrogen, female hormone, after puberty is blocked in boys, results in cardiovascular disease, decreased bone density, affects the growth of the brain and the development of the brain. The sex hormones are essential in the development of the prepubertal and the pubertal child and the adolescent child. Without the sex hormones, the proper sex hormones, the ones that are compatible with your biological sex, then brain growth is impaired. These effects are irreversible, they're permanent, and they're also, if you combine cross-sex hormones and the blocking of the puberty that results in permanent sterility. Again, permanent consequence of this treatment. What about the girls? The girls would receive or do receive testosterone, which is the male hormone, after puberty blockers, just like the boys. This results in increased lipids, cholesterol, and triglycerides, with the cardiovascular consequences of that. Decreased bone density again for the girls, liver disease, and excess of red blood cells. What about the adults? Because these children, boys and girls, eventually grow into adults. What are the consequences of adults of this gender transition? A U.S. study showed that 62% of those that transitioned from male to female resulted in significant clinical depression. 55% of those who transitioned from female to male also resulted in clinical depression, significant clinical depression. And it is important to also show or remark on the fact that about a third of each group, 33%, had attempted suicide. These are not happy people. These are very unhappy people saddled with significant mental illness. A Swedish group that happened about 15 years ago. The Swedes have more experience with gender transition than in the United States. They've been doing it for long, so they have the advantage of being able to have a longer follow-up time. So they did a 30-year study, and they found that those of the transition group had an incidence of frequency of suicide 19 to 20 times greater than the general population. So again, these are not happy people. They are unhappy, and they have an increased incidence of suicide attempt and actual suicide, suicidation and suicide. So what are the Europeans doing now? 2025, 24, 25. So gender transition has been practiced in Europe for many more years than it has in the United States. We started doing this terrible thing here in the US after the year of 2010. But the Europeans had been doing it, especially in Scandinavia, had been doing it since the 1980s and the 90s, so many more years than what we have. So by the late 2023, that's 2 years ago, or almost 2 years ago, several countries in Europe had prohibited or at least significantly restricted the transition of children. In the United Kingdom, the Cass report is well known. Hilary Cass is a pediatrician, and she looked at the process and the protocols and decided that it was not in the best interest of the child. So this was published, and it has been prohibited or close to being prohibited, except in the protocol research cases in the United Kingdom. In Sweden, Finland, Norway, and Denmark, which are the Scandinavian countries where this has been practiced for long, it has been prohibited or restricted very significantly. And Italy in the year 2024, late 2024, which is just about a year ago as well. Why this change of mind? Why did the Europeans change their mind? These are the reasons that they give, and I'm going to read them to you. Inherent medical and ethical uncertainties. They're unsure whether there are actually real medical indications for the sex transition in children, and whether it's an ethical process. Okay, so this is something that is pretty obvious. However, it's taken quite a few years for people to actually get to this point of understanding how this position is so terrible, so bad for the kids, providing minors with profound and life-altering interventions. that are long-term, that are sometimes irreversible, limited understanding of the growth and development of the child and what these interventions do on the growth and development of the child. We don't really know what these interventions do. Growing rates of detransitioners and profound concern about long-term outcomes. Again, many of these interventions are irreversible. They are irreversible. Okay, who are these? Just a few words about the detransitioners. The detransitioners are no longer children. They're grown-ups. They're adults that have gone through the transitioner process, who regret and are frequently very angry at medical providers and other adults that coerce them into the transition process. And there have been legal repercussions about this, legal retribution. So money talks. So some of these adults that coerced, or medical professionals that coerced these adults when they were children into going through the transition process, are being sued. And that also is an important fact, because money talks. People listen when their pocketbook is affected. So what about the United States? What's happened lately in the U.S. since the 2020s? So important pediatric associations in the United States continue to support this terrible practice. The American Academy of Pediatrics, which is the largest professional organization for pediatricians, it has a membership of 60,000 pediatricians. Very large organization. It continues to promote this harmful practice on children. Nobody knows exactly why they continue to do this. So does the AMA, by the way, the American Medical Association. They continue to promote this nefarious, harmful practice on children as the indicated treatment for gender dysphoria. So the reasons for doing this are unknown. Oh, by the way, not all 60,000 members of the AAP, of the Academy of Pediatrics, are supportive of this, I'm sure. It's just of a small but very powerful elite that it just promotes it and speaks for the whole organization. And the rest are just quiet, silent about it. So why? The reason for this is actually unknown. I don't know. I don't think anybody really knows, except that this very small elite is very powerful. So gender ideology originated in the 1960s in the United States, so it's been around for a long time, and it has been ingrained, I should say, in the culture. Maybe this is the reason, or one of the reasons, why the Academy of Pediatrics continues to support this harmful process. So, what else has happened in the United States? Ever since President Trump became president in 2025, he recently declared only two sexes exist, male and female. This is through an executive order. This is not a law in the United States. It's an executive order. But he has also, through an executive order, prohibited so-called gender transitions in minors. 27 states have turned this executive order into law. So out of the 50 states, 27 states have made this into law. So it is prohibited in those states. But remember that the United States has 50 states. So there's the other half that still have not done this. So it's still not prohibited in the other 25 states. But the rest, so the rest continue with this practice. So our old friend, Planned Parenthood, the abortion industry, Planned Parenthood, is promoting gender transitions in minors, of course. There's a lot of money to be made, and Planned Parenthood goes where the money is, and it's through its sex education. Sex education that promotes gender dysphoria and promotes the gender transition as the treatment for gender dysphoria. So this slide shows you our address in Miami, our telephone number, our YouTube. Remember that this information, these videos are in our YouTube channel, Vida Humana Miami playlist. Our email address, adolfo@vidahumana.org, and vidahumana.org, HLI.org if you want to access Human Life International in English, vidahumana.org in Spanish. And if you need to talk to us about anything or communicate with us about the videos or anything else to do, especially with our pro-life course, you can write to adolfo@vidahumana.org. Thank you very much for your time and for your attention, and many blessings.